3 exercises that I do to make sure I can protect the knee joint and optimize the mobility of that knee joint to prevent injuries. Knee joints are one of those niggly injuries that you get. It can be really frustrating. So many of the movements in CrossFit require, the knee joint being activated, so you want to try and protect that as much as possible. I'm going to cover, the first one is going to be covering what's known as the ITB muscle. The second one is going to be working on the quad muscles and make sure you can get the flexibility out of that. And the third one is going to be using a band to cause just slight distraction in that joint to really work on the mobility around that area. One of the more common injuries that I find is you'll get the ITB muscle, which attaches at the top of the pelvis and starts from a muscle known as the TFL, the tensor fasciae lata, and forms into a band that comes down and attaches to the side of the knee joint. This muscle is extremely difficult to stretch statically, which is why I see so many injuries with it. Over time, you can develop pain that develops on the outside of the leg. That can cause the knee to internally rotate, especially on a squat or on a max squat. You'll see that knee come slightly in. Over time, that'll cause pressure on the inside of the knee joint. And it can also cause just the rolling of the foot down there. So lots of biomechanical implications if this muscle is really tight, because it totally throws the knee joint out and the tracking of the kneecap. If you feel the outside of the knee and it's really, really tight and really sore to touch, that's an indication that this muscle is really tight. Probably one of the top 3 rolling that I will do to make sure I can keep this area loose. Now, I'm just going to use a roller. I'm going to start up the top here and generally just work down the side of that quad muscle, and I'm really going to work it in this area right here. That's where you get a lot of that forms into the muscular tendinous junction. You get a lot of tightness, and it'll have a big impact on that knee joint. I'm going to lie on the side. I'm going to start just above here and slowly work my way down into that muscle. Now, when I get down into this area, I want to use this other leg to take my weight. This muscle is very tender, especially when it's tight. You don't want to put too much pressure on it. I'm going to take the weight with this other foot and just slowly roll through that area. Now you can bend the leg and it just relaxes that muscle, and you'll be able to get a much deeper stretch. And just working it through there. I'm going to come right up as close as I can to the attachment point without putting any pressure on the bone. And just slowly working that area. Again, if this is really tight, you'll see that internal rotation of the knee joint on the squat movements, especially on the front squat, and any of those motions where you put a lot of pressure on that, something has to give and it affects the tracking of that knee joint. Stretching that, I'm spending about 30-45 seconds doing that on both legs. Make sure I can get that pressure off the outside. The second one while we're down here is rolling the quad muscles. The quad muscles, you've got 3 of them. They all attach at the front of the pelvis, come down. We've got one that goes on the outside, one that goes on the inside, and the middle one attaches to the kneecap. I'm going to start at the top. I'm going to slowly work my way down and rolling onto that. And work all the way down. I'm turning my body to make sure I can get all of that muscle in it. These aren't too bad on me. It's an area that I work closely, but when you find an area that's quite tender, just slowly work on that area to make sure you can just release it. And I'm going to do that on both legs. The third one, the final one for the knee, is going to be just what's called a banded distraction. I use just a band. What I want to do is I want to keep my one leg straight and the other leg bent. I'm going to keep this at a 90-degree angle. I'm just going to slowly take some of the pressure. Slowly just take the slack out of that. I'm going to contact the front of the knee joint. And I'm just going to slowly work it back. Now with this, you can turn the leg and I'll work different parts of that knee joint. If this is an area that you suffer a lot of problems, this is what I recommend. It's a more advanced mobility, just to really work on that knee joint. And then doing both legs there. I'm not trying to put too much pressure on it. You just want to get a little bit of what's known as distraction through that joint and gradually working that through. As you can see, they don't take a lot of time. I would prioritize the ITB to make sure that you're really working on that. It's not causing any biomechanical changes in the knee. Do these 3 and you're going to make sure you get the best results when it comes to the mobility of the knee. Enjoy.